Welcome to section 11.2 of genetics. In this section, we will be memorizing the details of Klinefelter syndrome. Let's get started. Our story takes place at a little kid's birthday party. Now this poor clown is getting felt up by a bunch of rowdy kids. We will introduce the rest of these rowdy kids in a moment. Just remember that the clown being felt up will represent Klinefelter syndrome. Now getting felt up is actually the least of this clown's concerns. You can see that this child has thrown a big trophy at the crotch of this poor guy. If you look closely at the trophy, you will notice that the person in the trophy is holding their hands up in a Y shape. This Y shape represents the Y chromosome present in these patients. Klinefelter syndrome patients have an XXY genotype. That Y chromosome causes them to be phenotypically male. So again, one Y-shaped trophy for one Y chromosome. Now the trophy being thrown at the clown's testes represents testicular atrophy. You can imagine that if you get enough trophies thrown at your testes at kids' birthday parties, you are bound to have some testicular problems. So again, testes receiving this big trophy for testicular atrophy. Now when it comes to the hormone levels that result from testicular atrophy, you should deduce these logically. Now this is a diagram of the seminiferous tubules, which is discussed in great detail in the physiology reproduction chapter. When discussing testicular atrophy, focus your attention on the seminiferous tubules and things will be clearer. There are Leydig cells here and they produce testosterone. You can see this Leydig cell right here. And if these Leydig cells are dysfunctional, testosterone will be low. And such is the case in Klinefelter syndrome. Without enough testosterone, LH will not be inhibited because as you can see, testosterone will actually go to inhibit LH. So as a result, LH levels will be elevated. Next, let's turn our attention over to the Sertoli cells. Sertoli cells release inhibin B, and inhibin B normally inhibits FSH. So dysfunctional Sertoli cells means decreased inhibin B, which means increased FSH. So once again, testosterone will be low, which means that LH will be high, and inhibin B will be low, so FSH will be high. Now, it looks like the father is not overly concerned with the chaos that his child and his friends are creating. In fact, he doesn't even seem to be aware of much of anything. Look at the newspaper he is reading. It's upside down. Now, trying to read an upside down newspaper isn't super smart, so we like to use this idea to represent intellectual disability. And people with Klinefelter syndrome often have intellectual disability. So again, reading newspaper upside down for intellectual disability. Now look at this kid sitting up here on the mantle. He is carelessly throwing down his dad's golfing trophy. That mean little boy. Notice that the trophy has two golf clubs forming an X. This represents an X chromosome. Now it looks like he already threw an X chromosome trophy down to the ground. These two X trophies indicate two X chromosomes. Looking at the X on the ground, you can see some other hooligan is smashing it with a bar. The bar breaking an X trophy represents the bar body of one of the X chromosomes. Bar body refers to a chromosome being inactive, which means only one of the X chromosomes fully contributes to the phenotype of the individual. Again, two trophies and one being broken with a bar stands for two X chromosomes, one of which is a bar body. So to summarize, patients with Klinefelter syndrome have an XXY genotype, with one X chromosome being a bar body. Now, like many birthday parties, this party has a cute little piñata. It looks like a unicorn. Now, unicorn kind of sounds like unicoid, as in the unicoid body shape of Klinefelter syndrome. The word unicoid comes from the word eunuch, which describes men who have been castrated and have become more feminine looking. They have wider hips, narrower shoulders, and overall, their frame just looks more effeminate. So again, unicorn for unicoid body shape. Did you notice how tall the clown is? That's fortunate he is so tall. If he was any shorter, it'd make it easier for these little monsters to abuse him. In any case, the tall, long-armed nature of this clown represents the fact that patients with Klinefelter syndrome are tall and have long extremities. Now look at this mean little boy. He took some tape, stuck it to the clown's arm, and ripped it off. You can see that he has left a few spots completely hairless. That little brat. Anyways, this hairless area on the adult clown represents the female hair distribution in Klinefelter syndrome. This makes sense. After all, they have testicular atrophy and associated hypogonadism. Plus, they have a more female body shape. So it stands to reason that their hair distribution would also be more effeminate. So again, mean kid ripping off hair from the clown represents female hair distribution. Let's turn our attention to this immature boy taking balloons and stuffing them up his shirt to make him look like breasts. Boys sometimes. Well, seeing as how his chest looks more feminine, even if totally artificially with balloons, we can more easily remember gynecomastia. Men with Klinefelter syndrome often present with gynecomastia, or female breast tissue. Again, this is consistent with everything else we know about these men. They have testicular atrophy, female or unicoid body shape, and female hair distribution. Plus, they have an extra X chromosome. And with that, you have learned all that you need to memorize for Klinefelter syndrome.